Hi, my name is Lori Kirkendall. I'm the Executive Director of Medical Institute for Sexual Health. I served on 3 health TEKS work groups, and I'm a certified sexual risk avoidance specialist. I would like to highlight for you a few data points that I don't think have been brought earlier today. Published data from government sources and many of the advocacy groups that you've heard from today shows that for over 20 years, the pregnancy, birth, abortion, and sexual activity rates of youth in Texas has been falling steadily and significantly. What hasn't fallen are STD rates, nor the emotional and mental health risks, which means sex today for teens is even more dangerous. Comprehensive sex education has tried to rebrand itself with the misleading term abstinence-plus. CSE presents a dual message to children. Abstinence is best, but protected, consensual sex is also a healthy, responsible choice. Public health evidence shows that it simply is not for kids. It's not time for a change. It's time for update, yes, and upholding of the statutory language of Education Code 28004, which clearly calls for locally controlled sex education that teaches and supports sexual risk avoidance. This helps all children achieve optimal sexual health. I therefore urge you to remove all references to consent, remove committed relationships and uphold marriage, use the terms STDs and STIs interchangeably as the Centers for Disease Control does, and remove the word potential, which weakens a clear prevention message. Include parents for STD and pregnancy testing and uphold the collaborative work of 6 work groups and the content advisors and the commissioner's report that has not included differentiated instruction on sexual orientation and gender identity or abortion for children in Texas. Thank you for your continued service and your great work on these health TEKS.
As if, I've gotten the actual data, but the data that I have now confirms with what I know as a urologist and the data that we were getting when I was in the Friendswood ISD school board for 10 years, that about 50 to 60% of high school seniors have been sexually active. And so my question to you is that if we do the absence only, the risk avoidance, do you really think that would have a big impact, significantly reduce the number of high school kids that are sexually active?
Well, first of all, I think it's important to look at that data where the age tips over. You're stating a graduating senior percentage, which tips right over 52% of graduating seniors. We're talking about required health TEKS for 7th and 8th graders, and that number is far less. In fact, in 9th grade, it's 20%. So I think it's important to notice it's really kind of middle of senior year that it tips over the 50% line. I also want to clarify, though, you asked about abstinence only or sexual risk avoidance, and those are very different terms, and there's been a lot of confusion around those 2 concepts today. I don't think we've heard anybody advocating for abstinence only as it's been defined in Just Say No, but sexual risk avoidance supports many of the concepts you've heard spoken of today. Healthy relationships and contraceptive education and on and on. I've provided some information for you all to better clarify what we're advocating for in sexual risk avoidance. But I think it's important to make that distinction. And I do believe that a clear message that's supported in the research and data that helps children, all children, regardless of their different individual, different perspectives along the way. It is an optimal sexual health message.
Any further questions? Mr. Mercer?
Thank you, Mr. Chairman. Ms. Kirkendall, I'm Ken Mercer. How you doing? I just have 4 questions on the 4 data points. I'm like Dr. Robinson. I want to make sure I understand what it means. And I look at a lot of things. The testimony you've given us, I look at Health and Human Services. I look at a CDC. I look at a campaign to prevent pregnancy and try to figure out what it means. So the 4 data points I'm looking at, and you can explain to me and the board here, are in the last 20 years, where we're at now with teen pregnancy rates, where we're at with abortion rates, where we're at with Dr. Robbins talking about sexual activity, and then where we are at with disease. And I will sum up by saying, it looks like the first 3 are going down, but the STD is going up. So again, those are the 4 things: the pregnancy rate, abortion rate, the activity rate, and then the STD rate. Could you please discuss those four?
Yes, so we usually actually include one more in that going down rate, Mr. Mercer, pregnancy, birth, abortion, and sexual activity. Those are all going down. I provided that in my written testimony to you all, where you'll see the 51% drop in pregnancy rate, the 74% in abortion rate, and then, as we've already talked about, the sexual activity rate that's dropped. And then what isn't going down, as you've mentioned, is STD rates, and you've heard about that a lot today. The risks are up at epidemic levels according to the Centers for Disease Control. So what that tells us is sex for kids today is more dangerous, and we can talk about failure rates, effective and ineffective rates, and those things that have been mentioned already that are included in the standards, and how that reflects back to the data on STDs.
But if the free rates are going down, but the infection rate disease is going up, what am I missing there? Is it the diseases are more serious? I don't understand. How can that be? How can the other three charts be going down?
It's a complicated point, and it kind of takes unraveling some of the data. So part of that is STDs are more rampant among young people than they have been. They continue to increase. And then also we see this idea of some of the antibiotic resistant bacteria that are changing. So gonorrhea, for example, can hardly be treated now. So there's some challenges around STDs themselves that have made them so bad. It's sad to see neonatal syphilis is rising again. So there's things that are not going down by any means in STDs, and I can provide a lot more of that information. We do a lot of that at Medical Institute.
Thank you, Ms. Kirkendall. Thank you.
Any further questions of this panel? Yes, Ms. Perez.
Ms. Kuykendall, if you could please help me. I'm very confused as to how sexually transmitted infections or diseases, that number, that count is increasing while sexual activity is decreasing. How are those two things both true at the same time?
Well, I think if you look at, again, the numbers across each individual disease, so breaking down bacteria, viruses, protozoans, there are over 30 different significant STDs to look at right now. And they all have kind of a different mechanism happening from a pharmaceutical perspective. I'm not a pharmacist or an MD for that matter, but I would speak to the point that part of it has also been, if you watch on the contraceptive use and condom use, condom use has sort of stayed along the same. So, and we can look at the failure rates of condoms preventing STDs. Also, there's been some kind of turnaround in some of the other risky behaviors. Oral sex and anal sex, which have been spoken of today, have increased, which are also means modes of transmission, as you've heard of, for STDs. Does that help understand the complexity of that?
Well, I think, and I'm going to repeat back to you what I understand, so you tell me if I get it right. Sexual activity is going up, and that's how sexually transmitted diseases are spreading. Oral sex and the others that you mentioned, they're increasing. These activities are increasing, right? Because these diseases are transmitted sexually. So if diseases are transmitted sexually are increasing, sexual activity is increasing.
Right, and so then the technical part is how you define sexual activity. So I referenced the YRBS, which came out this week, actually made national headlines in a couple of spots, that fewer kids are having sex than ever before in the last 20 years, right? So that made the news, fewer kids are having sex. The YRBS does not differentiate oral and anal sex. It simply defines sexual intercourse. So we don't have good data, only sort of what we're understanding largely from kind of social media and teens themselves speaking of these other kinds of sexual activity that put them in harm's way. So does that help?
No, not really, but thank you.
So they are less, I think it's an important message to kids and to adults that not all kids are having sex. In fact, most kids don't, especially when we're talking about 7th and 8th graders. So I think it's important to think through that messaging, because the media, our hypersexualized culture, has made it seem like all kids are, and all kids aren't. So that's an important part of sexual risk avoidance messaging also.
Right.
Condom use is down in a lot of studies. as I said, contraceptive use is down or not getting better after, years of different kinds of sex education, which can be debated also.
Okay, so if they're not participating in sexual activities, how are they contracting sexually transmitted infections and diseases?
Well, I just said that oral sex and anal sex are going up, or so we can presume. And then also there are still a number of teenagers that are sexually active, not using protection, and using condoms, which still have a failure rate. So it's a complicated answer to why STDs are bad. And I mentioned earlier, some of the STDs have become harder to treat and are more prevalent, especially in certain populations.
Thank you, Ms. Kuykendall.
Okay, I see Ms. Hardy next, I believe.
Just trying to get an understanding, there's more STDs out there than there used to be. They've morphed into all these different problems. So if fewer people are having the sexual activity, but the chances of getting the STDs are much greater than they would have been before now. Does that make sense?
I think so, yes. It is true there are more STDs today than there were. It used to be 2 venereal diseases, syphilis and gonorrhea, that were easily treated with antibiotics. And now we have over 30 significant STDs. So it's a whole different world out there in terms of risk. I think it's also important to look at a young adult population. So we're talking about school-age children. Things get a lot different in the 18 to 24-year-old age group, where we see, you'll see stats quoted as half of all STDs are among young people ages 15 to 24. We're talking about school-age children in kindergarten through 12th grade, and that's different. So 1 out of 4 sexually active young people will get an STD every year. Has been a number we've looked at for a long time. That number's 1 and 2 in the young adult population. So things do get different heading up above the ages we have them in public school.
Thank you.
All right, do we have any other questions from members? I'm going to call on Ms. Cargill.
Yeah, Ms. Kuykendall, in your document that you sent to us for grades 7 and 8, the standard about the legal implications regarding sexual activity as it relates to minor persons, including legal age of consent to engage in sexual activity with another person, and aggravated sexual assault if the child is under the age of 14, regardless of consent. Would you comment about your recommendation for that, about leaving the last part off? It's on page 54
Yes.
or 40.
Yes, thank you. I think what was added there made it more confusing, this whole idea, the last whole phrasing of it. I do think legal terms and terminology around sex and sexual activity are important. So actually, if you look up in Health 1, they're a little bit stronger, where it just is a list of these different terms, right? What is indecency with a child? What is sexual assault, sexual harassment, aggravated sexual assault? You can find those legal terms. I think where it was written weird, a little unclear to me, not weird, in 7th and 8th grade is this whole section about under the age of 14, regardless of consent. I would just stick it just like it is in Health 1 with those legal terms.
Okay, so put the same language in Health 1 in grades 7 and 8, because when I read the 7th and 8th grade language, it is very confusing. It's just not clear, but you're recommending that we look at what's in Health 1 and also put that in grades 7, 8.
Yes, there's a
Okay.
list right there in Health 1 in O. So it lists straight up statutory rape, aggravated sexual assault, decency with a child. That's going to have, as it relates to minor persons, so that'll have the age of consent also in there as well.
Okay, thank you so
Age of
much.
consent, speaking of it in a legal term, is very different than the kinds of consent education we were talking about deleting earlier.
Okay, thank you.